Welcome again to another exciting episode celebrating women in healthcare with Cimas. My name is Miss Red, and today we happen to be visiting a lady who's done quite a lot, over 32 years of experience within the medical space. And not only has she worked in Zimbabwe, but also in the United Kingdom and South Africa. She brings her world of expertise, that's 32 years of expertise, to this very establishment. Her name is Florence Ogwal, and she is the Principal Nursing Officer for Medical Investments Limited. So come through, let's hear her story and see how she is doing her part in terms of the medical fraternity when it comes to this establishment that is the Medical Investments Limited. So let's go. Thank you so much, Florence Ogwal, for finding time to, speak to us. I think you're such a busy lady. I've seen already within the few minutes that I've been in your establishment. But I think the first place where we need to start is, who are you? And where did you start your healthcare journey?
Florence is a God-fearing married woman with 2 dogs.
Oh, 2 dogs!
Yes, I've got golden shepherds.
Oh, beautiful, beautiful, yes. All right.
So I did my training in Zimbabwe. I did my training with United Flower Hospital for my general nursing. Then I went on to do my operating theatre at Harare Hospital. I worked for a couple of years in Zimbabwe before I went overseas.
And by the way, it's been 32 years of doing this. So you've been in the UK, you've been in South Africa, you've also worked in Zimbabwe. When you left, where was the first country that you left and went to work in?
So I went to South Africa at Banda Hospital in Mpumalanga province. I worked there for a couple of years, like 2 years. Then I went to UK at Hillingdon Hospital. So Hillingdon Hospital is one of the big NHS hospital that was taking overflow of casualty cases in the event that there was a disaster at the Heathrow airport. But I couldn't stand the cold in UK. Oh my way. So I left to go back to South Africa. So I went to Morningside. That's where I went to work. I was in theatre. As you know, I was now in operating theatre nurse. So I worked at Morningside, and then I left Morningside to be a unit manager at Milpark Medcare Hospital. After that, I left for a greener pastures or for a bigger post at Donald Gordon, where I was the deputy nursing service manager.
Okay, then what brought you back to Zimbabwe?
And, no, before that.
Oh, there's still some more?
Yes, there's still some. Yeah.
Wow.
So I left Donald Gordon. I went to, I was headhunted to go to Donald Gordon. And then I was headhunted again to go to Linksfield. Remember that I started at Medcare at Milpark. So the nursing service manager there was transferred to Linksfield. So she headhunted me. Then I went to Linksfield as a deputy nursing service manager. After that, then there was an opportunity of a Greenfield hospital that I was supposed to commission. So I went and I commissioned at the Bosanet Modafontein Hospital as the nursing service manager. And then I got promoted, or I acted as a hospital manager there as well. Yeah, that's when I started deciding, I think it's far much better to go home, and share my experience with my own people.
Yes.
That's what brought me here.
And what a world of experience that is, because you've been with a lot of, big end facilities, yeah?
I'm humbled. I think it's all through God's grace.
I like that.
I wouldn't have done it by myself.
Yeah. But have you experienced anything, being a woman, any challenges within your field of expertise?
You need to have the whole day for me to tell you about my challenges.
Give me a few.
So when I went to Uganda, I was the first Black person, professional person, to be in theatre. What they could only see was, the housekeeping people. They're the only ones who were allowed to be in there. Well, Africana dominated place. I thought, oh, okay, that's enough. when I went to Feast Donald Gordon as well, I found myself to be one of the 3 Black people in the boardroom, and I did not know how to speak Afrikaans.
Yeah.
I only knew a little bit of Afrikaans, just the greetings. So you can understand the challenges that I was facing through that. But you know what? Through God's grace, I managed, and I never actually dwell on my problems. What was important is the goal.
Yeah.
Yes.
At the end of the day, it's always the goal. But the theme for this year's Women's Celebration is actually invest in women, accelerate progress, right? So in terms of you and the way you've seen the industry, I mean, 32 years is not a short period, it's a very long period, and you've seen so much. What are some of the things that you feel in Zimbabwe need a lot of working on, especially with women, for us to be able to get to places like you have?
I would like to think that being assertive, assertiveness is quite important, and to have a goal, to know exactly what you want, and that anything is possible. When you want it, you can reach it.
And the other thing that I always like to ask, especially high achieving women, is how do you strike a balance? Is there anything that exists that's called work-life balance? Outside of the work, what do you do? What gives you balance?
You got to discipline yourself, because the work can actually suck you, because you leave work and you go home, you start working again. So you got to discipline yourself to say that I want to have a me time. So a me time is very important. You go maybe have a nice bubble bath with a little bit of a glass of wine and your candles. Yeah.
It's very important.
It's very, very important. And also, you know, it's very important to know that you still have got a life after work. Your family is very important. You need to have time for the family.
Okay, I love that. I'm struggling with my work-life balance, so thank you for telling me it's okay to find time for yourself. Before I go though, one piece of advice you'd like to give any woman, it doesn't necessarily mean someone in healthcare, but any woman in terms of life in general.
Especially in the health sector, is that you need to stay abreast and to embrace change. You know, like the medical field is always changing. You know, the moment you blink, there's something new that is already on the market. So it's very important that you stay abreast with what is happening in the industry.
Evolve or die. That's what they
correct.
say. Yeah, thank you so much, Florence, for finding time. I know that you're waiting for a call and you want to get back to work, but happy Women's Month, and we celebrate you completely.
Thank you very much. I appreciate that you brought the team to have a chat with me. I appreciate and I feel humbled.
Thank you. That was the Principal Nursing Officer, Florence Ogwal, with her passionate and beautiful story around how she has gotten to where she is. Now, I know everybody is wondering what we'll be having next, but if you have any questions whatsoever around what she does, around where she is, where she's been, it's always great to have you guys speaking to us on our socials. So drop a comment. See you next time.